If you're one of the 72 million Americans who are self-employed, it's time to decide on health insurance, and choosing the right plan can be complicated. And joining us today with more on what you need to know is co-founder and CEO of Stride Health, Noah Lang. Noah, thanks for joining us.
Thank you for having me.
So what is the best way to get started when choosing a health insurance plan?
Don't assume last year's health plan is the right one for this year. Step back, take an inventory of what you need. What are your health needs? The doctor visits that you might have planned, your prescriptions that you're taking this year, any conditions you're managing, or even mental health needs. And then you can start digging into the details of health plans. The second thing is get real about unexpected events. You're another year older. What kind of risks and health risks can you absorb financially? Are you willing to pay a little more every month to make going to the doctor a little less painful when you need care? And the third thing is to see if you qualify for tax credits to lower your premiums. More people than ever do, so don't assume that you can't.
What should you do if you're feeling overwhelmed by all the options?
If you're feeling overwhelmed, rest assured, you're not alone. The average American now has 7 different insurers in their area, each with a variety of health plan options, and it can be pretty overwhelming. I'd like to start by breaking down the terms. So first, familiarize yourself with the key terms like deductible. That's just how much you're going to pay before your insurance kicks in. Max out of pocket. You'll never pay a dime more than that. That's where your insurance will pay everything above that. Copays or co-insurance, those are typically what you're going to pay once your insurance kicks in to go to the doctor or see a specialist. Sometimes a lot of those insurance plans will offer copays before you hit your deductible. So make sure you check those out because they can lower the cost and the barrier to just going to the doctor for a checkup. The second thing is every health plan has 4 different levels of coverage. They call them metal tiers: bronze, silver, gold, platinum, basically ranking them from low premium to a higher share of your healthcare costs to a higher premium and a lower share of your healthcare costs. So if you're younger and you're healthier and you're not going to go to the doctor that often, you might go for a bronze or a silver plan. On the other end of the spectrum, if you really don't want to pay very much every single time you go to the doctor, you can choose a platinum plan. You may pay a lot more for your premiums, but you pay a lot less once you go to the doctor. So take a look at the terms, get familiar. And then the number one thing that I recommend you do is don't assume that a cheap health plan that looks cheaper because of the premiums is actually a cheaper option for you. Do an apples to apples comparison. Look at your healthcare needs, try and figure out what you might spend in each health plan, add that to your premium, and figure out what the right total cost of coverage and care is for you in the coming year. If that sounds hard, that's why I started Stride. We can do all of that for you. So the last piece of advice is ask for help now. At Stride, we have free advisors, free educational resources. We can help you out.
What is changing in self-employed healthcare plans in 2024?
First of all, you change every year. So your income may have changed, your health needs might have changed, the doctors that you have might have changed. So start with your needs and look at what's different from when you made this decision last year. Every year, premium rates, second thing, also change. This year, on average, premiums are going up by about 5%. The good news is, so do tax credits that might help you lower the cost of those premiums. They go up at the same amount. So you might be insured from that premium rate risk if you qualify for a tax credit. The third thing is that insurers are joining and leaving your city or state every single year. So the health plan you had last year might not be available this year, or it might be available, but there might be a better new choice. So take a second, look at your options and see if there's a better option for you for next year. The last thing that's changing is there are some things I like to call them supercharged plans. They're called cost sharing reductions on certain silver plans. You might qualify that lower your deductibles and lower your co-insurance and copays and can have a pretty dramatic impact on how much you're going to spend on care. So take a look and see what you qualify for.
And so how do you know if you qualify for tax credits?
So qualifying for tax credits, it all depends on your income. As I shared, good news is more people than ever qualify, thanks to the American Rescue Plan Act. Don't assume that you don't qualify. Most uninsured Americans that I meet assume it's unaffordable. So to find out, you can go to your exchange or healthcare.gov, or you can come visit stridehealth.com for a more delightful experience. Just give us your zip code and your age and how much you expect to earn next year. You'll estimate your 2024 earnings, and we'll use that to estimate your eligibility for a tax credit. that lowers your insurance premiums every single month that you pay them.
And finally, where can we go to learn more?
If you want to learn more, simple, just come to stridehealth.com. We'll help you find a plan for free. It's quick and easy. It's relatively painless. We also have advisors who are standing by, again, for free to help you out over the phones. And we have educational content. If you don't want to talk to us, but just want to educate yourself on those terms, stridehealth.com is the place to go.